Greetings, everyone. Dr. Melanie Crites here with the 360 Pelvic Health Institute and the Center for Men's and Women's Urology, coming to you from Portland, Oregon. And I want to kind of diverge off of the beaten path today just a little bit, but not really. Simply because we all know that this pandemic has really changed life as we know it. And it has changed communication with our physicians. Now we're doing more telehealth visits, and we're all learning how to embrace technology. We're learning how to communicate differently. But there's one thing that I hope that you all are trying to do, that I want to impart this knowledge on you or with you today, is that whole thing of self-care, especially in the age of a pandemic. Now, not only does this converge with the pandemic, but it is so, so important, and I talk to my patients about this on a daily basis anyway, for these chronic conditions, chronic pelvic pain, recurrent urinary tract infections, urinary incontinence, just these chronic conditions that we struggle with every day. And let's face it, anxiety, depression, chronic pain syndrome of the joints. So now more than ever in the age of pandemic, and when we're now just starting to come out of isolation just a little bit, it is now more than ever important for us to learn self-care and how to manage these chronic conditions. And urological conditions such as incontinence and chronic pelvic pain and recurrent urinary tract infections are really no different than the depression and the anxiety and the mental health challenges that a lot of the population have, and have been exacerbated by the fact of being isolated and not being able to keep up with our usual routines of self-care. Now, why I'm speaking to you about this? Well, chronic conditions and chronic urological conditions, I rely a lot on the help from my alternative care colleagues. So my yoga instructors, my acupuncturists, my herbalists and naturopath, Reiki and tuning forks, and all of those different sound therapy, all of those different things that we're doing, as well as going to the gym and stretching and our meditation and everything that we're doing is immensely important for those chronic conditions. And now, whether you're working from home or whether you're now able to work from your office, or you're still in that isolation stage because perhaps you're immunocompromised and your doctor doesn't feel like it's yet safe for you to be out in general population, and you still feel very isolated. A lot of patients have seen that their chronic conditions have become exacerbated because they've not been able to keep up with those usual things that they've been doing. So what I would like to encourage you to do, as we've been promoting this app called My Go Time to log your regulatory habits and your food journal and your symptom journal, that is immensely helpful for your urological conditions and your stomach conditions. It can also be helpful for your mental health conditions as well, to keep symptoms such as not sleeping well and finding out if you're actually eating your correct diet, since we've all had so much time at home to be able to focus in on those things, or not. Let's face it, some of us have put on a few extra pounds during pandemic because we've not been able to do our usual self-care routine by eating well and going to the gym. Some of us have also taken to growing a garden, which we've not done in years, to help keep us from needing to be out and to support ourselves with fresh fruits and vegetables and those sorts of things, and taking joy in preparing your foods, but keeping track of your symptoms, keeping up with your yoga to really help regulate and down-regulate your nervous system, to help really manage those chronic conditions that you're somehow struggling with. we all have to find a way. So certainly, reach out to your healthcare provider. Use the apps to be able to send that information to your doctors, especially in the age of telehealth. Embrace your yoga classes by virtual visits and your workouts by virtual visits if you have no other way, because I promise you that will help with your chronic conditions. And what I speak to with my patients, their chronic pelvic pain, their recurrent urinary tract infections, managing their weight, because that contributes to urinary incontinence. So reach out, embrace technology. If you're not really a techno buff, well, now's the time to really start becoming familiar with it, because like it or not, I think that this age of technology is here to stay, and we're probably going to be finding a lot of different and creative ways to keep in touch and to help find ways to treat our patients creatively. If nothing else, we're certainly in the age of creative minds and creative ways to treat things. So, as always, folks, stay safe, stay healthy, and thanks for letting 360 Pelvic Health help to restore your confidence.